We're diving into something super important for anyone over 60 or caring for someone in that age group. As we get older, our bodies change, and medications can hit differently than when we were younger. It's just how life goes, right? Most of us end up on some meds, but are they really safe for us? We've consulted with heart surgeons and geriatric specialists to bring you a list of 7 common types of medications that can pose risks for seniors. This isn't about scaring you, it's about empowering you with knowledge. The goal is to help you have more informed conversations with your doctor, ensuring your treatment plan is as safe and effective as possible. Remember, never stop or change any medication without speaking to your healthcare provider first. This video is for educational purposes only. Now, let's get into the first one. Coming in at number 1 are certain types of painkillers, specifically nonsteroidal anti-inflammatory drugs, or NSAIDs. You know these names: ibuprofen and naproxen. They're available over the counter and are incredibly common for treating aches, pains, and inflammation. While they can be a lifesaver for a headache or a sore back, long-term use in older adults can be risky. Why? Because they can increase blood pressure, which is a major concern for heart health. They can also affect kidney function and, importantly, raise the risk of stomach bleeding and ulcers. As we age, our stomach lining can become more sensitive, and the protective mechanisms just aren't as robust as they used to be. For someone with a history of heart issues or kidney problems, regular NSAID use can be particularly dangerous. Your doctor might suggest alternatives like acetaminophen or other pain management strategies that are gentler on your system. Next on our list, at number 2, are some common sleep aids. I'm talking about medications containing diphenhydramine, which is the active ingredient in many over-the-counter sleep products and allergy pills. While getting a good night's sleep is crucial for health, these specific drugs can cause more problems than they solve for seniors. These medications are known as anticholinergics, and they can lead to a whole host of side effects like confusion, constipation, dry mouth, and blurred vision. Even more concerning is the increased risk of falls due to dizziness and grogginess the next morning. It creates a hangover effect that can seriously impact your balance and cognitive function. Long-term use has also been linked to an increased risk of dementia. There are much safer ways to improve sleep, like establishing a good sleep routine, cognitive behavioral therapy for insomnia, or talking to your doctor about other safer medication options if needed. Let's move on to number 3, certain muscle relaxants. Medications like cyclobenzaprine or methocarbamol are often prescribed for muscle spasms and back pain. The problem is, they work by sedating the central nervous system. For an older adult, this heavy sedation can be very risky. Just like the sleep aids we just discussed, these muscle relaxants can cause significant drowsiness, dizziness, and confusion. This dramatically increases the risk of falls and related injuries, which can be devastating for a senior. They often provide very little benefit over safer alternatives like stretching, physical therapy, or using acetaminophen or topical pain relievers. If you're experiencing muscle pain, it is really important to discuss the root cause with your doctor and explore treatments that don't carry such a high risk of sedation and accidents. Number 4 on our list are benzodiazepines. This is a class of drugs often used to treat anxiety and insomnia, and includes medications like diazepam, alprazolam, and lorazepam. While they can be effective in the short term, they are highly addictive and come with serious risks for older adults. These drugs are powerful sedatives. They slow down brain activity, which can lead to memory problems, confusion, and impaired judgment. The link between benzodiazepine use and falls in the elderly is very well documented because of how they are metabolized. These drugs can stay in an older person's system for much longer, prolonging the side effects. Dependence can develop quickly, and withdrawal can be difficult and even dangerous for anxiety. Therapies like CBT and mindfulness, along with safer medications like certain antidepressants, are often a much better long-term solution. At number 5, We have some older types of antidepressants, specifically tricyclic antidepressants or TCA letters. Examples include amitriptyline and nortriptyline, while newer antidepressants like SSRIs are now more commonly prescribed. These older drugs are still in use, sometimes for conditions other than depression, like nerve pain or migraine prevention. The issue with TCA letters in seniors is their strong anticholinergic side effects similar to the sleep aids we mentioned earlier. We're talking about confusion, dry mouth, blurred vision, and constipation. More seriously, they can cause a drop in blood pressure when you stand up, leading to dizziness and falls. They can also affect your heart rhythm, which is a major concern, especially if you have a pre-existing heart condition. If you are on one of these medications, it's a very good idea to review it with your doctor to see if a newer, safer alternative might be a better fit for you. Okay, let's talk about number 6, certain diabetes drugs, specifically sulfonylureas like glyburide. This is an older class of medication used to lower blood sugar in people with type 2 diabetes. While it's effective at its job, it carries a significant risk for older adults. Glyburide has a high risk of causing hypoglycemia, which is dangerously low blood sugar. For a senior, an episode of severe hypoglycemia can lead to confusion, falls, loss of consciousness, and can even be life-threatening. It's also a long-acting drug, meaning its effects can be prolonged and difficult to manage once blood sugar drops to low. Newer diabetes medications are available that offer better blood sugar control, with a much lower risk of causing hypoglycemia. If you're taking glyburide, ask your doctor about newer, safer options. It's a critical conversation to have for managing your diabetes safely. And finally, at number 7, we have a combination that's not a single medicine, but a dangerous duo: anticoagulants or blood thinners mixed with NSAIDs. This is a crucial warning. Many seniors are on blood thinners like warfarin, or newer ones like apixaban or rivaroxaban, to prevent strokes or blood clots. These are life-saving drugs. However, when you combine them with an NSAID like ibuprofen even for just a few days, you dramatically increase the risk of serious bleeding. NSAIDs, as we discussed, can irritate the stomach lining and cause ulcers. Blood thinners prevent your blood from clotting effectively. Put them together, and a small stomach ulcer that might otherwise be minor can turn into a major, life-threatening gastrointestinal bleed. It's a recipe for disaster. If you are on a blood thinner, you must avoid NSAIDs unless your doctor explicitly tells you it's safe. For pain, acetaminophen is generally the much safer choice. So there you have it, 7 medications and combinations that require extra caution for anyone over 60. The key takeaway here is not to be afraid of your medications, but to be an active, informed participant in your own healthcare. Write down your questions. Keep a list of all your medications, including over-the-counter ones, and have regular reviews with your doctor and pharmacist. They are your best resource for ensuring your treatment is both effective and, most importantly, safe. Your health is your greatest asset, so take charge of it. Thanks so much for watching today. If you found this information helpful, please give this video a thumbs up and share it with someone you think could benefit. And don't forget to subscribe for more essential health tips. Stay safe, stay informed, and we'll see you in the next video.